Does getting out of bed feel like a major athletic event? Do your knees creak and groan more than an old wooden door? If you're nodding along, you're not alone. Joint pain is one of the most common health complaints out there, and it can seriously cramp your style, making even simple things like walking the dog or climbing stairs feel like a monumental task. It's especially common as we get older, but it's not an inevitable part of aging you just have to accept. Today, we're going to dive deep into what's really making your joints ache, and, more importantly, what you can do about it to get back to moving freely and feeling great. Let's get started. So, what's behind this widespread issue? Think of your joints as the hinges on a door. Over time, with a lot of use, they can start to wear down. One of the biggest factors is, you guessed it, age. As we get older, the cartilage, that smooth rubbery cushion between our bones, naturally becomes thinner and less flexible. It's a bit like the tread on a tire, wearing out after thousands of miles. This process is often called wear and tear. But age isn't the only culprit. Your weight plays a huge role. Imagine carrying a heavy backpack all day, every day. That's essentially what extra weight does to your joints, especially your knees, hips, and back. For every pound of body weight you gain, it puts about 4 pounds of extra pressure on your knees when you walk. That adds up fast and accelerates the wear and tear on your cartilage, leading to pain and inflammation. Now let's talk about movement, or the lack thereof. It might sound counterintuitive, but not moving enough is actually terrible for your joints. A sedentary lifestyle weakens the muscles that support your joints. Without strong muscles to act as shock absorbers, your joints take the full impact of every step. Regular, gentle movement, on the other hand, helps to lubricate the joints by circulating the synovial fluid, which is like the oil that keeps the door hinge from squeaking. It keeps everything moving smoothly. Genetics also has a hand to play. If your parents or grandparents had joint problems, you might be more predisposed to them as well. Some people are just born with a genetic makeup that makes their cartilage more susceptible to breaking down over time. It's not a guarantee, but it's a factor to be aware of. And of course, we can't forget about injuries. A bad fall, a sports injury, or a car accident from years ago can come back to haunt you. An injury can damage the cartilage or misalign the joint, setting the stage for arthritis and chronic pain down the road. Even repetitive stress from a job or a hobby, like typing all day or playing tennis, can contribute to joint strain over time. Beyond these lifestyle and genetic factors, certain diseases are major drivers of joint pain. The most common is osteoarthritis. This is the wear and tear type of arthritis we mentioned earlier, where the protective cartilage on the ends of your bones wears down over time. It usually affects the hands, knees, hips, and spine, and gets progressively worse. Then there's rheumatoid arthritis, which is a different beast altogether. This is an autoimmune disease, meaning your own immune system mistakenly attacks your joints. It causes widespread inflammation, leading to painful swelling, stiffness, and eventually joint deformity. Unlike osteoarthritis, which often starts on one side of the body, rheumatoid arthritis is typically symmetrical, affecting both sides at once, like both wrists or both knees. Another painful condition is gout. This is a form of inflammatory arthritis caused by a buildup of uric acid crystals in a joint. If you've ever had a gout attack, you know it's no joke. It often strikes suddenly, most famously in the big toe, with intense pain, redness, and swelling. It can feel like your joint is on fire. High levels of uric acid can be caused by diet, particularly rich foods and alcohol, as well as certain medical conditions. Nutritional deficiencies can also contribute to weak bones and joints. If your body isn't getting enough of the right building blocks, It can't maintain healthy cartilage and bone density. Key nutrients like calcium, vitamin D, vitamin C, and omega-3 fatty acids are all crucial for joint health. We'll talk more about how to get these in your diet in just a bit. So now that we understand the causes, let's move on to the good stuff, the solutions. The great news is there's so much you can do to prevent joint pain and manage it effectively if you already have it. First and foremost, let's talk about weight management again. As we said, losing even a small amount of weight can take a massive load off your joints. It's one of the single most impactful changes you can make to reduce pain and slow the progression of arthritis. Next up is exercise. Remember, motion is lotion for the joints. The key is to choose the right kind of activities. Low-impact exercises are your best friend. Think swimming, water aerobics, cycling, and using an elliptical machine. These activities strengthen the muscles around your joints without pounding on them. Strength training is also vital. Building up your leg muscles, for example, creates a strong support system for your knees. Don't forget about stretching and flexibility exercises like yoga or Tai Chi. They improve your range of motion and reduce stiffness. The goal is to be consistent. A little bit of movement every day is far better than one intense workout a week. Let's turn our attention to the kitchen. Your diet is a powerful tool for fighting inflammation and building strong joints. You want to focus on an anti-inflammatory diet. This means loading up on fruits, vegetables, whole grains, and healthy fats. Omega-3 fatty acids are superstars when it comes to reducing inflammation. You can find them in fatty fish like salmon, mackerel, and sardines, as well as in flax seeds, chia seeds, and walnuts. Certain vitamins and minerals are also essential. Calcium and vitamin D are the dynamic duo for bone health. Strong bones provide a solid foundation for your joints. You can get calcium from dairy products, leafy greens like kale, and fortified foods. Your body makes vitamin D from sun exposure, but many people are deficient. So supplements or fortified milk and cereals can be a good idea. Vitamin C is also important because it plays a role in collagen formation, which is a key component of cartilage. Berries, citrus fruits, and bell peppers are packed with it. If you're already in pain, what are your options for relief? Over-the-counter pain relievers and anti-inflammatory drugs like ibuprofen or naproxen can provide temporary relief from pain and swelling. However, they aren't a long-term solution and can have side effects, so it's best to use them as directed and for short periods. Topical creams and gels containing capsaicin or menthol can also be applied directly to the sore joint for localized relief. Beyond medication, there are many hands-on therapies that can make a huge difference. Physical therapy is fantastic. A physical therapist can create a customized exercise program for you to strengthen specific muscles, improve your range of motion, and teach you how to move in ways that protect your joints. Massage therapy can also help by improving circulation, reducing muscle tension around the joint, and promoting relaxation, which can help ease pain. For more severe cases, your doctor might suggest more advanced treatments. Corticosteroid injections, for example, can be delivered directly into the joint to provide powerful, albeit temporary, anti-inflammatory relief. These are often used for acute flare-ups of arthritis or gout. Another option is hyaluronic acid injections, sometimes called viscosupplementation. This involves injecting a gel-like substance into the knee joint to act as a lubricant and shock absorber, mimicking the natural synovial fluid. In the most severe situations, when cartilage is completely worn away and pain is debilitating, surgery might be the best option. Procedures like arthroscopy can be used to clean out debris from a joint, but the most common surgery is joint replacement. This involves removing the damaged joint and replacing it with a durable artificial one made of metal and plastic. Hip and knee replacements are incredibly successful surgeries that have restored mobility and quality of life for millions of people. It's a major decision, but for many, it's a life-changing one. The most important takeaway here is that you don't have to suffer in silence. Joint pain is complex, and what works for one person might not work for another. The best first step is always to talk to your doctor. They can help you get an accurate diagnosis and create a personalized treatment plan that addresses the specific cause of your pain. Living with joint pain can be challenging, but by taking a proactive approach, managing your weight, staying active, eating a healthy diet, and working with your healthcare team, you can significantly reduce your symptoms and get back to doing the things you love. It's about making smart, sustainable lifestyle choices that support your joints for the long haul. Thank you so much for watching today. I hope this video has given you some helpful insights and a sense of hope. If you found this information valuable, please give this video a thumbs up and don't forget to subscribe to the channel and hit that notification bell so you won't miss our future videos. We'd love to hear from you in the comments below. Share your own experiences or tips for managing joint pain. Take care, and we'll see you in the next one.